So let's begin with Frühschicht. Frühschicht is the early morning shift. It is also known as Frühdienst. Both are the same. And then there is one more shift, that is Spätdienst, during the daytime. So there is a Nachtdienst, is a night shift, and then Ambulance is the outside department. That means the patients coming to the doctors, they see the doctors and they don't remain in the hospital. They take away the prescriptions and they go. That is Ambulance. Station, particular ward, W-A-R-D, wards in a hospital. And in ward itself, there will be different rooms. These are known as Stationszimmer, different rooms in a particular ward. Ward for children, ward for people who are injured, pediatric version, orthographic ward, and. And in each ward, there will be a doctor in charge of that ward. He is known as the Stationsarzt. Then, in a station itself, there will be a Chefarzt. He will be responsible for the whole thing which is happening in that particular ward. There will be a HNO, it is a Hals, Nase, Ohren, that is known as ENT specialist in English. And then, if a patient is there in the station, in a Stationszimmer, there will be a particular Besuchszeit, a time to visit, visitor's time. Usually in Germany, Besucher, that means just visitors, are not allowed. Only Angehörige. Angehörige, you should understand the term very well. It is family members, close family members of the patient. Only they are allowed to visit the patient, whether it's in the morning or in the evening. Then you should also know something about the Notaufnahme. Notaufnahme is an emergency intake, emergency ward. And in an emergency ward, the moment a patient is admitted, the first thing that they do is to do the Verband. If there is a Blutung, if there is blood coming out, and then immediately they will take him to a Röntgenabteilung. Röntgen is X-ray. And there will be a Arzthelfer. Many people confuse this Arzthelfer with a Krankenschwester. A Arzthelfer is not a Krankenpfleger. He is just a doctor's secretary dealing with the official things, files, mainly official, and not looking after the patients. So there will be Arzthelfer and Arzthelferinnen also in every station. And then what you should do is that the first thing that you have to keep in mind is there will be colleagues and patients in a hospital. And whether you had to say "Sie," that is a formal "Sie" to them, or "Du" to them, there are no specific rules regarding that. And you have to decide in consultation with the doctors and your colleagues and patients whether you can say "Sie" to them, or whether you have to say "Sie" to them, or whether you can say "Du" to them. But be careful here, the Germans are in this field a little bit sensitive. The very first day, it is better that you say "Sie" to everybody, especially to your colleagues and to the Chefarzt. To the Chefarzt, you should never say "Du" unless you are very, very intimate with him. It's always better that you say "Sie" to him. And then when the Kontaktaufnahme is already there. When the Kennenlernen is over, you have become friends or close, then in consultation with them only, you can decide whether you can say see or do to them. Now let's begin with some other topics. If the patient is there, you had to do the bed for them, a clean bed, remove the cover of the Kopfkissen. Kopfkissen is a pillow. And all these things together, there is a term in German for that, ein Bett, frisch Bett ziehen. Don't ask me why is that Bett ziehen. It is like that, it's a particular term. Ein Bett, frisch Bett ziehen means to make the bed clean for the patient. Then there will be a Kopfkissen, there is a pillow, and that part where the head is being rested is known as a Kopfteil. Decke is the bed sheet. If the patient is asking you to put his head a little up, that is Kopfteil hochstellen, and some patients would like to have it flat without a pillow, that is Kopfteil flachstellen, to make it very flat. The next thing is Mundpflege, which is very, very important as far as nursing is concerned. To have a clean mouth, because many infections, many viruses will enter the body through the mouth. So the mouth of the patient should be always clean. You know the terms Zahnpasta and Zahnbürste, toothpaste and toothbrush. Once the mouth is clean and clear, then it comes the Körperpflege, nursing of the body of the patient. The body has also to be very clean and hygienic, otherwise they will get a lot of infections from the air. So this Körperpflege, when we talk about Körperpflege, you have to think about the Waschbecken, a wash basin, or the Waschlappe, a piece of big cloth with which you can wipe the body of the patient. But one thing you have to keep in mind, Waschen und Körperpflege sind intime. It's a little bit intimate to touch the patients, especially in some parts of the body and all that. And that's also a individual Angelegenheit, that's strictly between you and the patient. So in Germany, the usual practice is the men will always take care of the male patients and women will take care of the female patients. But it can happen at times that your boss or the chief nurse is asking you to look after, to do the Waschen and Körperpflege of an opposite sex. You should be mentally prepared for that. Then some usual terms which are inevitable in a Krankenpflege or in your profession. Wurde ins Krankenhaus eingeliefert. Don't think too much about it, you just understand it as he was admitted to the hospital. Wurde vom Krankenhaus entlassen. He was discharged from the hospital. In your Sprachunterricht, you may have learned the meaning of entlassen as dismissed. But here in this particular sentence, wurde vom Krankenhaus entlassen, it is not dismissed but discharged. That you have to keep in mind. A patient is wurde ins Krankenhaus eingeliefert und wurde vom Krankenhaus entlassen. Important prepositions, ins, vom. That you have to be very careful. And the term Arzthelferin und Krankenschwester, we have already discussed.